Good evening. I'm Wilson Stribling. Welcome to Quorum. Things are starting to move more quickly at the state capitol. Yesterday was the deadline for bills from each side of the legislature to make it out of committees in the same side. Tonight, we will be talking to members of the House Public Health and Human Services Committee. We invited members of the Senate Public Health and Human Services Committee, but they were unable to attend due to another commitment. Our guests tonight include the chairman of the committee, Representative Sam Mims. He is a Republican and a native of Macomb. His district includes portions of Adams, Emmett, Franklin, Lawrence, Pike, and Walthall counties. Also tonight, Representative Brad Mayo. He is a Republican and serving his first term in office. His district includes Lafayette County. Also on the panel, Representative Cecil Brown. He's a Democrat and is serving his fourth term in the House. His district includes Hinds County. And finally, we're joined by Representative John Hinds, Sr. He's a Democrat and has been in the legislature since 2001. His district includes Washington County. And remember, we want to hear from you tonight. There are several ways you can contact us. You can call us toll-free at 1-877-405-5247. You can email us at quorum@mpbonline.org. Or if you use Twitter, just use the hashtag Quorum. So we want to start with some basics tonight, and the first question I'd like to ask is of you, Mr. Chairman, to explain just exactly what the Health and Human Services Committee does. What all do you oversee?
Well, thank you, Wilson. I'm glad to be here tonight and glad to be with my committees as well, committee members as well. And the Public Health Committee has a vast responsibility. We include all types of health legislation, from teen pregnancy to mental health to hospital issues, and so funeral home issues, and so you name it, the public health deals with it. It is a large committee. Probably several hundred bills come through this committee. And so it is a large responsibility that this committee has. And
the Department of Human Services falls under your purview,
does.
Right?
You name it, the Department of Health does, DHS, mental health. Again, you name it, healthcare-wise, we will probably take a look at it.
Representative Brown, tell me what the biggest issue facing this committee. I would assume it's probably the same thing every year, but what's one of the biggest things y'all have to tackle each year?
On public health?
Yes, sir.
Yeah. Gosh, as the chairman said, there are numerous certificates of need for hospitals. Is always an issue. It comes up every year.
Because in Mississippi, if a hospital wants to expand or even renovate facilities, they have to get that certificate of need.
They have CON, certificate of need, and that's always a big issue. And it changes in some ways, but in many ways it's the same every year. I mean, public health in Mississippi is a big issue. As you know, we have some of the sickest people on average and some of the most needy people on average of any state in the country. And so we've always got needs out there that we have a hard time meeting. If you come to a meeting of the Public Health Committee, you can't get in the room, as the chairman will tell you. Of the major non-money committees in the House, I'd say public health and public education are the two that are the most, that have the most interest from the public in general. And so the chairman has a tough job here in sort of herding all that and steering things through.
When you say you can't get in the room, because there's so much public interest in what the committee controls?
Huge room and lots of people. Lots of lobbyists, lots of individual citizens out there, all sorts of public interest groups. I mean, think about your own health. And that's the same interest these folks have. They have their interest in their own health and the health of others. So it's a major deal to have a public health meeting, and any bill that's brought up in public health has a lot of public interest in it.
Representative Hinds, you come from the Delta, where I would assume your committee has a lot of interest because of needs of Delta residents for the things that your committee oversees. What are the particular needs in your area that your committee has to deal with on a regular basis?
Well, I happen to chair Youth and Family Affairs, and so a lot of the issues that are coming from the Mississippi Delta have family interests, and so we try to look at what is going to take place with those issues, how it coincides with public health, education, appropriation. We try to make sure that if there's an opportunity to impact the lives of families, we want to have an opportunity to do that. Interesting, you know, Mississippi Delta has led the nation for years in health disparities. So the role I like to be is an advocate for the health disparity category, because only a few years ago, the Department of Health really gave interest to the health disparities.
Describe what you mean when you say health disparities.
Health disparities are issues like cardiovascular disease, colon cancer,
how the incidence can be so much higher among one group or area. as compared to
It's
another?
normally higher in African-American population as well as Native American population have higher indices when it comes to those type issues. But the disparities comes with relative to people having access to health care as well as treatment of health care, knowledge of health care, and the resources. So when you look at, for instance, all of us sitting here at the table, the person that would probably be looked at as having the worst health disparity would be me because I'm the largest one of the group. Mm-hmm. However, my lab work probably would be better than most of these guys sitting here. So
why do you say?
Because I'm healthy, but obese. And so a lot of times you have people who fall in one category, diabetes. You could be a second or third generation diabetic, and your issues concerning diabetes will fall into heart disease, or blood circulation. I mean, just a whole litany of categories will open up one of the issues on health disparities. And then trying to resolve those issues most of the time come from a person having the ability to understand how do I seek help and what would be preventive medicine.
Yesterday, during your committee meeting, you all passed House Bill 1174. I got a little copy of it right here. I guess this is the size of many bills that come your way. It deals with child care licensure, which I believe is now done by the Health Department. But if this bill is passed, that would move it under the Department of Human Services. Can one of you give me the details of why this would be a good thing, why this would be a good piece of legislation?
Well, I'll be happy to. Our Vice Chairman, Toby Barker, handled this bill in a committee yesterday. And basically right now you've got the Department of Health inspecting child care facilities. The money goes to DHS, and DHS transfers the money to the Department of Health, and they inspect the facilities. And so this bill, in my opinion, simply takes that responsibility away from Department of Health and goes to the DHS. And so you know, there's many child care facilities in Macomb that my children went to, and I don't think they're going to see a change at all. I think they'll see a person come that used to be from Department of Health, and now they'll be from DHS. And so I don't get a sense it's a large issue to me.
Well, Wilson, let me comment on that. I talked to a representative from the governor's office yesterday after the meeting, and this is a continuation of a sort of a move to consolidate services for kids in the early learning situations, child care situations, to try to consolidate services and make sure the delivery system is not only more efficient but more effective. Johnny Franklin, who's been involved in this for a long time, both under Governor Barber and now under Governor Bryant, has been sort of pushing this. It has to do with a move toward making sure that both licensed and unlicensed child care providers have access to good services, that the system is efficient, and that we're doing a better job with it. And I was not as supportive during the meeting as I was after the meeting when I had a better explanation about exactly why we're doing this. I think it's a good move. You know, there are more steps in the chain to be done, but I think they're moving toward a better delivery system for all the kids in the state.
Would there have to be any transfer of personnel from one agency to the other to get this done? Because I imagine there are a lot of people out there, when you consider how many child care facilities we have in this state.
Tons of them.
To transfer that burden to a different agency, would you be transferring people as well?
Well, it's my understanding that the employees that are at the Health Department will now be working under the Department of Human Services, but they'll still be employees of the Health Department. But Wilson, to be honest with you, there's a lot of pushback from the from child care providers. They feel like they have not had an opportunity to have a voice in these decisions. They have concerns that one entity having control over these decisions will adversely impact their opportunities to service children. So it is not as kumbaya as some people would have you think. There has been a lot of conversation about this alignment would help with the funding to rise to the top. And where there were 37 grant applications nationally, Mississippi came 35th in the advocacy group that prepared the grant to get the funds for rise to the top. So there are some issues that are really driving this vehicle other than just aligning the licensure part up under the Department of Human Services. Now I will tell you this, I believe Jill Dent, who's running the Department of Human Services agency that handles child care, I think she's doing an excellent job. I think she's very sincere in trying to make sure that children and parents have the adequate resources they need. However, this has been a cash cow for a lot of agencies like planning and development districts for years. So now some of the entities, some of the people outside the room see there's an opportunity to probably seize some money other than having these resources go to serve the children as well as the families. So this has been, I've been intimately involved with this for probably the last 2 years. So it is not as, smooth as is being perceived.
Well, regardless of what agency they're operating under, what are these inspectors, when they go out to these child care centers, what exactly are they looking for?
Well, they're just looking to make sure that the children are safe, they're in a safe building, the criteria that they have is in place. And so I think there's a move to make sure they are teaching what they need to be taught. You want to make sure the personnel there is who needs to be there, make sure they're certified, make sure, I think going back and make sure the children are safe. And so that's the key, make sure the food is healthy. Again, you have to be careful in my mind because you have private entities, and I'm taking my example back home in Macomb, they're doing a good job. And so, yes, we want them to come by and make sure the food is healthy and everybody's safe, but after that, we don't want the folks from the State Department coming into our facilities down in Macomb at private child care centers. Now, there are some that may want that, and so there's a fair balance there.
All right. Well, still on the subject of the Department of Human Services, it has been said or has been alleged by some that DHS is too big. It is an enormous agency. Some say it is too big. Representative Mayo, we haven't heard from you yet. I know you're new to the committee, and but do you think DHS is too big?
Wilson, I'll be honest with you. I have not. I don't feel qualified to make that statement. I have not reviewed their employment numbers, and I wouldn't. That'd be unfair to comment on that.
Do the rest of you hear that criticism, and do you think it's a legitimate criticism?
This stuff goes in cycles. There were 25 years ago, everybody was on this consolidation of agencies kick. Where you took all the functions and tried to put them into a single agency, and we built all these big agencies. And now a lot of people are saying, well, they're too big. We got to split them all up. How many agencies do we need? Some states have cabinet systems where you have a cabinet officer under, and you have general responsibility. I mean, we could have a cabinet for education chief, for example, and move all of IHL and all the community colleges and all the K-12 under one. Is that too big or not too big? It's not a question of big or little. It's a question of being effective and efficient in what they do. And to me, that's what we need to focus on, not whether the size of the agent. We're not going to cut down the number of state employees by simply saying, well, the agency's too big, so we're going to split it all up. That'll probably increase the number of employees. We're talking about consolidating school districts. At the same time, we're talking about splitting up agencies. I don't quite get that.
But be truthful, the Department of Human Services is short-staffed now. They don't have enough social workers. They don't have enough master-level social workers to do the function that their agency really is called to do. So to talk about it's too big, they can't place enough social workers within the system to go out and do home visits. In some counties, they're supposed to have 20. They only have like 8.
Is that because they can't find qualified people to do the job, or they don't have the money to hire the people?
Both. It's both. In order to fit some of those job descriptions, you have to be a master level social worker. Some social workers are not master level. 2 years, well, actually last year, we changed some of the law that some of them could be counselors rather than social workers to try to fill the void. And again, earlier we had a brief conversation about paying people enough. We don't pay people enough in the state of Mississippi to get the true, pure quality of people that we should have working for us.
So do you think DHS is, despite the hiring issues that might be there, is it run as efficiently as it could be? Are there more efficiencies that could be achieved, whether it's dividing it up or anything that your committee can do to change that?
I would like to see those employees receive proper compensation. And I think we need to hire more people to lessen the workload. And what I mean by that, I want a person who, let's use social work. I want a social worker who's handling a certain number of cases to be able to handle all the cases, check on those kids, check on those seniors, and not be overburdened. A lot of the problem that we have with our state people working for our state agency, they qualify for some of the services that they offer to the people in the state of Mississippi. So when you begin to look at what we are doing as an entity in this state, we are working people and asking a lot of them at bare minimum wage. And so a lot of time you have people who are providing quality service, but they're overworked, overburdened. And it's unfair to have a state employee working a 40-hour job, leaving this job, can't go home to tend to her kids, going to a part-time job just to make ends meet. So we really need to look at the system.
Yeah, this whole business about is there waste in the system? Yes. Is there waste in a bank, at Trustmark Bank? Yes. Is there waste at IBM? Yes. Is there waste at Microsoft? But it's not like they're big pieces that you can slice out. I mean, nobody's 100% efficient. No business is 100% efficient. But when you go through state agencies, and I've worked with state agencies a good bit, these people are dedicated, hardworking people. For the most part, they are career state employees who want to do a good job and want to be compensated fairly, just like in any other occupation anywhere. Mm-hmm. Could it be done better? Maybe. But again, I'd go back to any business out there. I think any business owner would tell you we could all do a better job if we'd all do our job 100% all the time. It just doesn't happen that way. But there's not a lot of waste in government. Could human services do a little better job? Sure. But so could every other agency, and so could every business in the world.
And I do think with our budget the way that it is this session, you're going to see us have to cut state spending. And we're in that process now with appropriations bills, and you're going to see us have to make cuts. I'm not sure we'll be across the board the same amount in each agency, but you're going to see cuts. And so I think we'll have to deal with that. And so you will see agencies and departments have to do more with less. And that's just the reality of where we are with our appropriation process. Yeah.
Or do less with less, which is what's going to happen in a lot of agencies.
Don't forget, you can ask these gentlemen your own questions. You can call us at 1-877-405-5247. You can send us an email, quorum@mpbonline.org, or you can go to Twitter and use the hashtag Quorum. And in fact, we have a Twitter question for you right now, and here it is. This is from Cynthia, and she asks, what bills are before the committee that will impact the health of women in Mississippi?
Well, we've had a busy session with the Public Health Committee. I'm very proud. We've got probably 15 or 20 bills that passed out of the committee. 2 other bills were pro-life bills that I think I think impacts women's health. And so we were very blessed to pass out 2 pro-life bills out of our committee. And so,
what would those bills do?
2 bills. One that says if you're going to, if a physician's going to perform an abortion, that the physician must be a certified OBGYN and must have privileges at a local hospital. That's the one bill. The other bill was a double referred bill, which means it went to 2 committees. The bill said that you had to had to listen to the heartbeat of the baby before the abortion.
You, meaning the mother?
Yes, before the abortion was terminated, that you had to listen to the fetal heartbeat. And then at that point, make that decision. And so I think that's 2 important pieces of legislation that we passed out. It deals with women's health, and we'll vote on that in the next few days.
So that goes to the full House
it does.
next.
That's correct.
Gentlemen, what do you think the chances of those bills are?
Well, Wilson, honestly, I think it's not fair to women to have men making these decisions. I think if we're going to talk about women's health, we should have women come together, especially, I don't have a problem with the ladies who are involved in making the decision. We should support their decision.
Are there not ladies on the committee?
But yes, this is an issue that's driven by men. We tend to tell women what we want them to do with their bodies, and that's not fair to the interests of women. If we're going to do anything concerning a woman's agenda, they should be making the decision. We should be supportive of it. But it don't happen this way. It never happens this way. We tend to drive the bus and tell them to get on or get off.
Representative Brown, do you agree with that assessment?
Well, let me focus on another bill that I voted for both those bills. But let me focus on another bill. There's another bill called the Patient Protection Act that I think is an important bill. The State Medical Association has been pushing that bill for a while. It has not passed before, but it's passed now, and it basically, as I understand it, requires all medical professionals to disclose their level of competency, what their education requirements are and what their certifications are, so that you know exactly what you're getting when you go into someone who's delivering medical service, exactly what kind of service you're going to get from them. So, for example, if they're an MD that says MD. If they're a DO, it says DO. If they, a dentist, it'll disclose that. If they're a nurse practitioner, it discloses that, so that the patient has an idea of exactly who that person is. Unfortunately, over the last few years, I've had the opportunity to have some medical services in terms of back surgery. And these folks walk in there, you don't even know who they are. You don't know who they are. They don't know they're a nurse, anesthetist, or, you just don't have any idea. And this bill would require them to display that and tell you who they are. I think that's important for not just for men, but for women too. I think that affects women's delivery services.
Representative Brown's exactly right. Every bill in there is important to women's health, just like it's important to men's health.
So
just simply put, I think every bill that has come through there is important to the health of all Mississippians. So in that way, everything that's come through has been important to women. He's exactly right. It's a truth in advertising bill, essentially.
And of course, I'm a father of 3 children, 2 little girls and a little boy, and so I guess when I look at legislation, I don't say this is for women's health or men's health. I really do look at it for everybody's health, and he's correct. And so I just don't make that difference, I guess.
All right, we're going to move on now to the Department of Health. We talked about funding cuts and the inevitable, what seems inevitable anyway, but is the legislature giving the Department of Health all that it needs to do what it needs to do? Mr. Brown?
No, and I think what you're going to see, well, we don't know what we're going to give this year, so let's start there.
Right.
But the budget recommendations so far, including the Joint Legislative Budget Committee, which I served on, recommended underfunding Department of Health. The governor's office, both the prior governor and this governor have done the same thing. I don't know what the Appropriations Committee is going to do in terms of their recommendation. I'm no longer on the Appropriations Committee, but I think you're going to see the Democratic caucus in the House come forth with an alternative budget plan where we will restore, in our budget proposal, a substantial portion of the money that's been cut in the Department of Health. Yeah. Government doesn't do many things well, and there are a lot of things it ought to stay out of. Public health's not one of them. The government has to be involved in public health. Public health affects everybody in this state. You can't, if you're going to have an epidemic, it's not going to be stopped by private physicians. It's going to be stopped by the public health service. That's who stops it. And so when you have things like inoculations and those kinds of things, that's got to come through public health. And we've got to provide that enough funds to be sure that the Public Health Department of Health, is providing health services to those people who might infect the rest of us, if nothing else. So there's not enough money there.
In a lot of this, especially when it comes to funding, about choices and difficult choices. We talk about, we've devoted full programs here to education, and we talk about education the same way we do about health sometimes. We cannot skimp on education. You can't skimp on public health. Isn't it about just making these tough choices, and how do you do it?
It is, and Representative Brown knows very well. The problem is we can only appropriate what the taxpayers send us. And so folks are working less, making less money, then we have less money to spend. And so at that point, we are going to have to make some very tough choices. And so our K through 12 budget will probably get 45 to 46% of the budget, like it normally does, around that. And so then you're left with a lot less money to spend. And so we do have to make some very difficult choices. And so we're going through that appropriation process with all the healthcare budgets, going through them line by line, trying to find where we can save money, and then look at these programs that are truly worthwhile and make sure we can fund them. And so the Department of Health is vital to our citizens. We have to make sure they have the appropriate money. But what that amount is right now, none of us simply don't. We don't have that answer right now.
If that amount is not where you'd like it to be, what would be some of the tangible effects of the Department of Health being underfunded?
Well, I think we just don't know. I think we'll have to get with them to figure out which services that they may not have the funds for. I do think we've got to get back eventually. It's some of these healthcare issues that we have to, individuals have to take responsibility for our actions. And so are there things the Department of Health is doing today that maybe 20 years ago they didn't do? Maybe the families were doing that for themselves 20 years ago and now they're not. I don't know. I think that's something we can ask questions about, and really do some investigation with that.
Wilson, I think that this comes to basically people having an opportunity to participate in preventive medicine rather than people who are already sick. If we did, for instance, I offered a piece of legislation a year ago to give elementary school students, all students, yearly physicals. they talked about it would cost too much to do it. But however, if you gave a person a physical, demanded they had a yearly physical, we could catch the onset of juvenile diabetes, someone who had other asthma or losing their sight. You could catch some things that later on down the line that would cost a lot of money. We end up missing young girls who end up getting pregnant, have an underweight baby, for infant mortality rates. Those things shoot up the cost of medicine. There are some things that we could do. We could change how we practice these principles and save money in the long term. I think that there are some people who are working within the system who have outstayed their time. And what I mean by that is that things have changed. There's a new way of doing business. And if we could find the right people who have the savviness to work and function in some of these jobs, we will see different change. There's some bright, talented people who work at the Department of Health who will not be given an opportunity to show their skill sets. And those people have some bright ideas. I had a chance to, one of the things that I was proud of, I was invited to have a conversation with some young dentists. And we had some conversation about them establishing their practice in rural Mississippi. And they were excited about opportunity, someone to go back home and cause a soon, quick, and immediate change to health concerns, in the dentistry area. And the same things happen with nurses. They're excited about opportunities to do some things. But when you don't give those people those opportunities to showcase their skills, we hurt the general populace.
So whose responsibility is it and whose duty is it to go in and empower those people and to weed out the people who aren't doing their job?
Well, I think that starts off with the executive director for the Department of Health. There are some people who, and I'm not saying anyone should be fired, I want to be very clear on that, but there are some people who are stagnating the process and who are being covered because it's a good old boy network. And the people who are suffering are the everyday populace. And so we have to hold people to a higher accountability. There are issues when you look at some of the programs. Breast and cervical cancer program in this state has been one of the best programs.
Which one?
Breast and cervical cancer program has been one of the best running programs in this state for years. But yet a couple of years ago they sent back $250,000 to the Susan G. Komen Foundation because of, they say it was some language that the legislature had put in a bill. However, they got refunded by Susan G. Komen, but they didn't get the $250,000. They got much less, like $50,000. So it's opportunities like that, there's problems like that where people are just having issues working things out to better the state. We can't pay for everything. But what we can do is have more efficient and capable people in place to come up with ingenious ideas to change the course of our health care delivery system in this state.
So, Mr. Chairman, how do you empower people to come up with ideas that could do the things he's describing?
Well, he makes some great points, and of course he's from the Delta. My parents are from the Delta, and so I went to school at Delta State, and so I understand the Delta, and I get it, and I think statewide we have to look at health care. I do think some of the health care issues are choices that we make. I think individuals have to be responsible for their actions. I think I have asthma. I have an asthma inhaler I'm carrying with me right now, and so it was my parents' job to see that if I was coughing and wheezing, to go take me in and get me checked. And so I think there's a fine line there as where we put the state, make the state responsible for those actions, and then where do we make the parents responsible for those actions. And so, as my colleagues know, I tend to lean on the individuals and the the parents have to have that responsibility. Yes, the state has a role, but for me it's very limited. And so I think we can still, I think, try to move our health care forward, but also maintain that parents and individuals have to be responsible for their actions. Having said that, we know that parents aren't always doing that. And, not everybody was fortunate enough to have two parents who loved me and showed me love and still love me today and helped me as a child and grow up and took care of me. And so I realized not everybody has that loving family that I did. And so we need to be mindful of that as well.
Well, along the same line of thinking, we mentioned teen pregnancy and low birth weight. There is new legislation that's in place that would change a little bit the way sex education is taught in Mississippi schools. Would public health be improved? Could it be improved by a more rigorous sex education program in schools?
It's not just a minor change, it's a major change.
The one that's taking place now?
Yeah, absolutely. Prior to this, the law said that basically school districts didn't have to do anything.
That's true.
But if they did anything, it had to be what's called abstinence only. That was the education. Right. The new bill says they have to do something, and they can choose between abstinence only and abstinence plus, which is more sex education, more detailed sex education. And that bill is a result of a joint legislative committee that was formed 3 years ago now, Republicans and Democrats, who spent months going through looking at options and having hearings, and some of the most conservative Republicans in the Senate were involved in it. Some of the most liberal Democrats in the House were involved in it. The vote was unanimous on this bill. The vote was overwhelming in the House and overwhelming in the Senate to put the bill in place. And we're very hopeful. What it does is it basically sets up a system where every school district has to choose one of the two programs. And although we've had some criticism, well, everybody ought to do one or the other. No, let's see what works. And what this does is we'll be able to compare outcomes in school districts with abstinence only and school districts with abstinence plus, and let's just see what works. There's a lot of evidence out there about what works in other parts of the country, but let's have a Mississippi experiment. We're going to look at what every school district does, and then we'll be able to come to the legislature and others, Department of Health and others, will be able to come back and say, well, based on the evidence that we have, this is what we should be teaching. So I'm pretty excited about it. Now, we've had some difficulties getting it implemented. There's been some resistance at the local level. But to be honest with you, I don't care. We got to do something. I mean, we've got a terrible problem in this state. And Democrats and Republicans together, including our previous governor and our current governor, have said we've got a problem. We need to deal with it.
Do we know what the breakdown is? How many districts have chosen abstinence? How
well,
many
some
have chosen
haven't chosen
plus?
yet. The deadline is not passed yet. So
Okay.
we have some that have not chosen yet.
Now, there's a group going around with a evidence-based program that's abstinent plus that they're actually paying for the material, training the teachers how to implement the program. And Sanford Johnson, he's out of Clarksdale, he's heading that program up. The truth of the matter is, when you look at the numbers that come from the CDC through the state of Mississippi, when you talk about the rise in HIV, the rise in STDs, syphilis and gonorrhea, the numbers of people who are contracting, there are younger people contracting those diseases and older people who are contracting those diseases. So I feel like if you can catch a young person at just before puberty kicks in and get them the right information, and sometimes parents are uncomfortable having conversations with their children because we see our kids as our darling babies. We don't see them as budding adolescents who hormones are raging and running across, and they are very tender to have those conversations. And you have to have someone who can be an intermediary, help them, bridge those conversations. I might not want to ask my mama why I'm feeling this way, but I might be okay with Mr. Brown, who's my science teacher. I can ask a general question that everybody in the class is curious about, and we can get an answer. It takes a village to raise a child, and we've gotten away from the village. I think Sam brings up some very valid points. There has to be personal responsibility, but I think I'm as much responsible for Sam's children as Sam is. And Cecil is just as much responsible for my children as I am. And we all are just responsible for Brad kids. We have gotten away from taking on the responsibility of helping each other raise our children, and we're paying the cost for it now.
Representative Mayo, are you hopeful that this new sex education legislation will improve public health in Mississippi?
I am. The birth rates and the STD rates in our state are staggering, and they hold us back in every way. We had, I guess, what could be considered an abstinence plus program at Oxford that they taught in our 9th grade health class, and we had some very shocking images that I think helped people make a lot wiser choices, and I hope that will work across the state. We have got to get a handle on our teen pregnancy problem and our STD problems.
Well, hopefully over the next few years, as this process is studied, we'll know, and then on Quorum in a couple of years, we'll be talking about different statistics. We'll see.
Wilson, I'll be the lone voice and say I had some concerns with it, and I did not support the legislation. I understand that we have a problem, and we need to do something about it, but I'm uncomfortable giving that responsibility to teaching our children about sex to somebody else. I'm living it right now. My children are 13, 10, and 7, and so I'm living it and breathing it daily at my house. I go home every night. I live in my home, and so I see it. But I think it's my job, my responsibility, and so I'm uncomfortable giving that responsibility to a teacher to teach. Teaching abstinence is one thing, but when we go to abstinence plus, are we dumbing down the situation? Are we saying it's really okay to go have sex, and why can't we just focus on what we need to do is not have sex?
But
and
you can opt out.
And you can opt, and that is the
parent,
legislation.
but
I think I just
You're talking about the schools can opt out.
well, the
No,
parents,
the parents can opt out. Their children
could.
have
So
to.
I understand we have a problem. I understand that all parents aren't teaching their children, but I just don't think it's the state's role. I still tend to fall back that mom and daddy brought this child in, and we need to raise it.
Well, in Mississippi, there are so many families who are single. You mentioned you came from a situation too where you had two loving parents who were in the home all the time and saw to it that you learned these things. What about the overwhelming number of Mississippi families who don't have that, who have one parent in home who might be working 2 or 3 jobs?
It is. It's a sad situation, and we have to figure our way out of this. And I think we've got to get back to where we're going to church, where we're praying, where we're teaching our children right from wrong, and our values and our views back the way it was 25 years ago. And I know that's going to be difficult and challenging, but I think we've got to strive to that. We've got to expect mom and dad to stay together and get married and have a baby at that point in that order. And I think once we don't expect it, then I think we're going down a slippery slope, in my opinion.
Let me agree with Sam on that. I think the culture, I mean, I'm older than anybody in here, and the culture has certainly changed, and it is damaging our kids. And I would like to see the traditional families. I would like to see people go to church. I'd like to see ministers stand up in the pulpit and preach about this. I don't think they're willing to do that. I'd like to see the mayor of all the cities, the boards of aldermen, school superintendents, and everybody else preach the same message about family values and culture and all that kind of stuff. The problem is it's not happening. And in the meantime, you got kids dying. You got low birth weight babies. We've got the highest infant mortality rate in the country. We've got kids dying. We've got kids dying from disease. We've got the highest HIV infection rate in the country. We have got to stop this. And the only way I know to do it is to stop it or impact that now is through education. If you want to talk about choices, people can't make choices without information. They can't make reasonable choices without information. So the whole program is to give kids, and these are kids, this is not teaching sex education to a 5-year-old. We're talking about kids in high school, kids
Middle school,
high school who are already interested in this stuff. And just give them accurate information. They're going to make their own choices regardless of what we do, but at least give them the information to make valid choices, make rational choices. That's what I'm concerned about.
I want to touch base on something. We can't say a person is not being raised right because they come out of a single-parent household.
Fair point.
There are a numerous amount of women who have done outstanding jobs raising children.
Our fathers, I'm sure.
And fathers
right.
also. I want to make sure that the record is very clear on this. Isaiah Thomas, the Hall of Fame basketball, was raised in a single-parent home. Mama ran a outstanding home. I can go back and talk about Barack Obama. I can talk about Wilbert and Cleotha Montgomery, who both went on to play pro football, who from Greenville, Mississippi. I can talk about John Hines, who was raised up in a single-parent household. And my mom had some rules, my grandma had some rules that we followed explicitly. I was married when I had my first child. I think that when you give people the right kind of information and the right kind of support, I want to go back and emphasize, people are not assisting people with raising their children today. Don't you touch my child, don't you say nothing to my child, that ain't my child, it's not my responsibility. We have gotten away from this concept of a village raising a child. The other thing that is, so if Sam is doing it and Brad is doing it, Cecil is doing it, I might as well try it. And we have kids who are succumbing to peer pressure at an all-time high. I think the eradication of family wholesome TV shows have played a major role in this. Yep. You see kids glamorizing group sex. You see people glamorizing homosexuality. You see people, and I'm not saying because people have different alternative lifestyles. What I'm saying, they're glamorizing things that tend to have negative outcomes rather than glamorizing things have positive outcomes. How many times have you seen on TV an ad where children are eating apples? But you see children eating potato chips, you see children eating Oreo cookies and all that, but you don't see children just going in, pulling a banana or eating an apple. So we always glamorize the negative things. We have to get away from glamorizing negative things in this state. If we're going to change the image of Mississippi, the conversation has to change. Well, we have to aggressively change this conversation.
We've done a lot through the bills that we passed in the legislature that require health education back in the schools. I think long term that's going to make a major impact, putting physical education back in the schools. So we've done some things, making healthy foods available in the schools, getting the potato chips and soft drinks and all that stuff out of schools. That will pay dividends long term, but we've got a lot more to do.
Very good. We have a caller on the line now. Michelle is calling us from Brandon. Michelle, I know you've been patiently waiting. If you'll go ahead with your question now, please. Do we have Michelle? We'll try to get back to Michelle here in Brandon a little bit in just a little bit. We do want to remind you, if you would like to place a call and chat with us, you can do so by calling 1-877-405-5247. You can email us. It's quorum@mpbonline.org. Or you can use Twitter and just use the hashtag Quorum, Quorum. We want to talk about HIV and AIDS. The Mississippi Health Department said they would need an additional $2.5 million from the legislature to match the federal Ryan White grant to help treat people with HIV and AIDS. Will the health department get those funds, do you think? And is that something that needs to be done?
I would hope so. I've been advocating for this funding for the last 4 years.
Because explain how this works. It's a matching grant.
It's a matching grant. You have to have a certain amount of money in order to receive the big chunk that Ryan Wright sends down, the federal government sends down for Ryan Wright. Ryan Wright takes care of medicine for people who have HIV and also helps with housing. It is not often talked about in this state, but there's a huge housing problem for people who are HIV positive. A lot of time when landlords find out a person is positive HIV, they tend to find reasons to move them out of their apartments and what have you. There's a huge ignorant stigma that follows with HIV. They think, well, if you HIV positive, the walls will have AIDS, you know, and so people are a lot of times disenfranchised. So the medicine for people who are infected with HIV is extremely high. But if people get on the medicine early enough, they have an opportunity to live longer, have an opportunity to be very valuable in the community. And so I've always advocated for this, and I think it's the right thing to do.
Do you think it's going to happen? Do you think they'll get the money from the legislature?
I'm counting on guys like the chairman of public health who understands that this is a huge issue from the public health sector, and my colleagues that sit on public health to assist us in making sure that we receive this fund.
So, Mr. Chairman?
Well, we're hopeful. We simply don't know. We're in the process of going through the budget right now, and I just cannot tell you what will be appropriated to the Department of Health, which monies will go to which parts of that agency, and so we're going to do our best. But today I simply don't know.
Let's go back to the phone lines now. We have Wally calling from Jackson. Wally, go ahead with your question, please. Do we have Wally? All right, we'll move on, and we'll encourage you to still call, and we'll get you on the phone.
Third time's a charm, I think.
Yeah, that's right. So we need a third caller to call, and we'll get them right on through. Let's move on now to the quality of medical care in Mississippi. Do you think that that folks in Mississippi get not just adequate care, but quality care when they go to the hospital in Mississippi?
It varies from region to region. You know, sadly, we have what are considered medically underserved areas. And going back to the bill we discussed earlier, I think that that having this Truth in Advertising, the Patient Protection Act, you'll be able to better discern what's quality care and what may not be quality care. Another bill that we have passed is going to expand the residency programs in our state, and that will get them out of just Jackson and maybe put them along the coast or somewhere in North Mississippi, so that we can grow our physician base for the long term. We have got to continue to spread it into the rural areas and to continue to support our rural physicians education program.
The governor in his State of the State address talked about creating medical zones in different parts of the state. Any of you think that concept of a medical zone, sort of a cluster of medical facilities, could that improve medical care in Mississippi?
I hope so. And as Representative Mayo mentioned, we have a bill that we passed in our committee that will expand and hopefully grow our physicians throughout Mississippi. And we all need more physicians in Southwest Mississippi, the Delta, and Jackson, and other parts of the state. So this is one piece of that puzzle. And I think what the governor is trying to do, I think, can only benefit our state.
We in the House have been pushing, as successfully as it turns out, to build up the cancer center at the University Medical Center. We now have the Mind Center, which you may not know much about, but it's an Alzheimer's research unit out there that's the only one like it in the country. They've got a $26 million federal grant to study Alzheimer's disease, and they're working with a number of major medical centers across the country. That's a big boost. The whole idea, I mean, the medical research and the other things we're doing can be a big economic development engine for the state of Mississippi and for this area, but they also deliver quality medical services. I'm really impressed with the physicians that we have in the state and their commitment to stay here. If you look at the credentials we have, I would invite you to go to the University Medical Center website sometime and look at the physicians and look at their backgrounds and where they came from. It's just absolutely amazing, because they don't make any money relative to what they could do in other parts of the country. Same thing with our private physicians around the state. If you go to Hattiesburg and look at the hospital down there and the physicians that work in that hospital, or Tupelo, or lots of other places in the state, the problem is there are pockets in the Delta and other places where you just don't have enough doctors. You have quality doctors, but you don't have enough people to cover. I mean, the ratio of people that live in the community relative to the number of medical delivery people that they have is astounding, that those people are working themselves to death.
And we do hope this bill that we pass in the House committee could help bring more doctors to the Delta, and I think that's one avenue to get more up there.
Well, Dr. Warren Jones years ago talked about having medical homes, and it was a catalyst to bring people into a system, a medical care delivery system that will help people have access. And one of the things that I like about what we're trying to do now, economic development can derive from our crisis in healthcare. If we can find a way to make money off providing services to these people who are caught up in the health disparity category, the cancer category, Alzheimer's, because there seems to be a large number of people in the state who are suffering from those issues. So if we can turn this into economic development tool, I can see Mississippi turning around, moving from, very low on the medium income to probably the top 4 or 5 if we take advantage of, I believe that you can take bad lemons and make good lemonade. And now we have a lot of bad lemons hanging off the vine, so it's time for us to start making some lemonade.
We're going to try the phones one more time. Dolores is calling from Jackson, and we're going to try our best to put Dolores on the air. Dolores, go ahead and let's see if we hear you.
Yes, how are you today?
We can hear you loud and clear. We're great. Go ahead, please.
Oh, yes. I'm calling concerning House Bill 1174, and I'm trying to find out exactly, this is where the child care licensure will be moving to the Department of Human Services, and I want to get how these people feel about the move, and how do they feel that it will help child care in the long run.
Thank you, Dolores. We talked about this at the beginning of the hour. Maybe we could answer it in a more general term of what your personal opinion is of this, and how moving the licensure of these child care facilities from the health department to DHS, just overall, what, in a nutshell, why would that improve the situation?
Well, I think you're going to have it under one agency, excuse me, and I hope it will run more efficiently and more effectively. And again, I just don't see a harm if they're following the rules and regulations that DHS puts out. I just don't see that it should harm the daycares. And so I think it should be hopefully a seamless approach going from 2 agencies under just one. So I don't think it's going to be a, hopefully she won't see much difference down the road.
I'm glad we got back to this because I follow up on something my colleague here said, Representative Hines, earlier. One of the things we're not as good at in the legislature as we should be is getting input from all the constituent groups. In this case, for example, we need to be sure that we've heard from child care providers, the delivery system, we've heard from parents, we've heard from people, the employees, we've heard from the agencies. Sometimes we get in a rush. We have what we think are great ideas and we try to pass legislation or even pass legislation and find out, well, there are a lot of reasons maybe we shouldn't have done it that way. So I would be careful in this. I support this based on what I've heard, but I think we need to hear from all the constituent groups, particularly from the parents and the child care providers out there about how that's going to affect them and whether or not they actually support this.
Well, you're going to have to be successful in this. The child care providers and the parents have been through a whole lot within the last 6 months. And what I mean by that, they took the certificate program from the Planning and Development Districts and now it's back up under the Department of Human Services. And the certificates and the vouchers for child care, they haven't had opportunities to send those out to take the people off the waiting list. So that's one caveat of problems. Then you come and you're realigning how licensure is done. And some of the providers feel like they have not been given a fair shake in this whole process. Their concerns have not been heard. Some of them have been strong-armed by certain agencies and stuff, so they are not really, they feel more vulnerable than secure in this move. So we have to be very wise about what we're doing. But more importantly, my position is I want to make sure that the child is safe and the parent has access. Then I'm concerned about the providers and then the system. Because ultimately, what we do to a child has an effect on them the rest of their lives. So we need to make sure the child and the parent is safe, because we're talking about restoring and repairing families here.
Since we had some success with Dolores' call, we're going to give it another go. We have a phone call now from Lauren. Lauren, go ahead with your question, please.
Yes. My question was, how does it contribute to the well-being of a child to deny a family member temporary emergency custody simply because they live with a partner that they are not at that moment married to?
Anybody want to take that?
I don't quite understand.
Is Lauren still with us?
It sounds like a judicial issue to me.
Yeah, I understand the question. I'm not sure that.
Aren't you a lawyer?
Your committee
I am not a lawyer.
Yeah.
I'm not a lawyer either, so
Not a judge either. So.
There seem to be so many issues involved with that DHS has to deal with on a daily basis, where you have parents who might be separated and custodial issues, and then you have the grandparents involved, and all have different interests perhaps, but all perhaps are interested in the best interests of the child. And DHS has to make some tough decisions in that whole process. And how can you, in your committee, help ease that process? Is there anything you can do? It's a daily.
You know, the DHS has, you have an executive director, and we have people in place to go out and do their job and make these decisions. And so.
But not enough of those people.
I guess not. But
well, you've got. I mean, it's not the legislature's
is it job
to do that. I mean, you've got the executive branch, you've got the judicial branch. A lot of what she seemed to be talking about is. It sounds judicial questions, and we don't have the expertise, and we should not micromanage government. It's not our job to do that. We make the laws, they enforce the laws, they administer the laws, and then the judges make decisions about what interpretation of the laws.
But her concern does need to be addressed, and so I think she would be best served making a phone call to her local youth court or to the county agency and ask those questions. She deserved to have an answer, and so I would like to encourage her to make a phone call, to your local youth court judge as well as the Department of Service.
She can call any one of us at the Capitol, and we can
connect her with somebody.
Connect her with somebody, sure.
I'd like to close with this question. Aside from money, if you could have one thing on a wish list and you could be granted this wish for your committee, what would it be?
Well, maybe not just the committee, but in general for health care, I do think that we have to take responsibility for our actions. and I think we do have a segment that wants the government to make decisions and to come in and take over. And I think, you know, I'm looking at this committee a little differently, and so I'm looking at legislation to make sure that the individuals are the ones who can make decisions for their health care, for their own decisions, but also having the mindset that there are people out there that don't have the families to do that for them. And so I think there is a balance there that we have to be mindful of.
Representative Brown?
Well, I'm on the other side to some extent of this. I'm much more concerned about that overused term, the safety net. I think there are folks out there who need help, have help with their health care needs, their public health care needs. I think that Department of Health, Department of Mental Health have a vital service to provide to folks in the state of Mississippi, and we got to support them. You know, and that's just my view of it. And if I had one thing I would wish is that we were a healthier state, that people would do what Representative Mims says and take care of themselves. In a perfect world, people would do that. They would eat right, they would exercise, take care of their children. That's not the way the world is right now. And so the government has a role to play in making sure that we protect other people.
Mr. Brown, Mr. Hines, Mr. Mims, Mr. Mayo, we thank you all for being with us tonight. We thank you for joining us here on Quorum. We'll be back next Wednesday night at 7, and the topic will be highways and transportation. I'm Wilson Stribling. Have a good evening.